The COVID-19 pandemic has prompted an escalation in gender-based violence against women and girls in southern Africa. This is according to a report by Amnesty International released earlier in the week. During the lockdowns imposed by southern African countries, some homes across the region became enclaves of cruelty, rape and violence for women and girls trapped with abusive family members with nowhere to escape the danger. Harmful gender stereotypes embedded in social and cultural norms which suggest that women must always submit to men and that a man who beats his wife does so because he loves her have also fueled the rise in violence against women and girls in Madagascar, Mozambique, South Africa, Zambia and Zimbabwe. Amnesty International's Director for East and Southern Africa, Depros Muchena, joins me now via our video link for more on this. Good afternoon to you and thank you so much for joining us.
Thank you. Good afternoon to you as well. Thank you for having me.
Now, you've actually found that the COVID-19 pandemic has prompted an escalation in gender-based violence against women and girls in southern Africa. Take us through the findings of the report.
Thank you very much. I think one point we must mention from the point ongoing is that governments in southern Africa adopted a public health response to the pandemic. And this public health response was preoccupied with essentially generating regimes of lockdowns. So we had 6 state of emergency declarations, 6 state of disaster declarations, and some hybrid measures that were taken, certainly in Zambia and Seychelles. These measures required enforcement, which took security and military operation to enforce. And by so doing, it exacerbated pre-existing problems. The first one being the problem, of course, of unemployment, poverty, inequality, and the disruption into the informal spaces of the economy essentially worsened the situation for people and for women in general, for women in particular, rather. COVID-19 then exacerbated pre-existing structural gender discrimination and inequalities, which resulted in spikes that we recorded across each of these countries on gender-based violence, both in the home and in the public space. The second finding in the report is that governments across the region didn't factor the specific needs of the adverse impact of the pandemic on women and girls in the design and execution of their policies of quarantining and lockdown. So they failed then to provide the basic services that were then needed in the spaces that women were located. And the third issue, that these spaces, private spaces, really became enclaves of cruelty, enclaves of rape, enclaves of violence, and enclaves of murder, as we recorded cases of gruesome murder of women across the region. And this results in us calling for a series of actions that must be taken by states individually and by SADC member states collectively.
Now, before we get to the series of actions that must be taken by these member states, can you talk to us about the emotional state of some of the women, girls, and perhaps boys who found themselves trapped in these enclaves of abuse during lockdown?
Well, it's a journey of emotional wrenching if you were to go through the report. First, with respect to spikes of cases, you will know that in South Africa, for example, in the first week, there were 2,300 reported cases just in the first week in April of gender-based violence cases from homes. That was pretty much the situation across the region. In Zimbabwe, an organization that monitors gender-based violence called Msasa Project recorded 764 cases in the first 11 days, rising to 782 within the first 13 days of the pandemic. That was also the situation we found in Mozambique and in Madagascar, with the exception of Zambia, which nominally registered a decline. So these cases tell a story that something was going on. You will recall that on the 8th of June, here in South Africa, Sekofatso Pule, a young woman of 28 years old, went missing, was found after 4 days, badly stabbed, hanging on a tree, dead. We have cases in Zambia of Dr. Talisa Banda, who is a medical doctor who was stabbed to death by her soldier boyfriend in the barracks in the barracks in Lusaka, near the barracks in Lusaka. We also had a situation of a woman killed in Mozambique, in Maputo, in Matola district, by a husband who then proceeded to kill himself afterward. So when we say trapped in enclaves of fear, of violence, and of death, we mean precisely that these stories in each of our countries reflect a growing concern of pre-existing problems of violence, rape, and sexual violence that became exacerbated because for long periods of time, women complained of being locked down with their abusers, locked up in places that were far away from services that generally are made available for women victims of GBV. Because as you know, lockdown regimes closed services such as counseling, shelter service, medical, and so on. And I think it became a very gruesome picture, and it continues to be unless governments take decisive action to stop it.
And let's speak then about some of the series of actions that you say the various governments in the Southern African region have to actually take. I mean, I just think about some of those harmful gender stereotypes that are embedded in societies and in cultural norms that tend to protect the perpetrators and make the victims actually scared of reporting the crimes.
Correct. You know, I think we see a combination of family structure in the context of patriarchy that unite to limit the prospects of reporting cases of gender-based violence. Because I think family harmony and patriarchal order is prioritized by families over the rights of women. And this has fueled the inability of women to get justice. The second is that even when women are able to escape those sites of violence, a number of the cases we dealt with reflect a criminal justice system that is still thoroughly male-centered and cynical to the crimes that we are dealing with, such that when women report cases at the police station, they are subjected to secondary trauma, they're subjected to secondary violations because of the types of questions that they are asked by police officers who are either untrained, unwilling, or unable to provide the sort of protocol and regime that secures women who are victims for them to be able to restore confidence in the criminal justice system. We also have a situation where the courts were unable to provide services because they also became victims of lockdowns in a time when many other countries were starting to provide online and technology-based services to ensure that vital justice mechanisms remained open. We also had a situation, where hunger in general, because of the closure of the formal and informal economic spaces, created an environment in which desperation levels rose up in the home. Quarrels, people starting to remain together for longer periods of time, and the contradictions between relationships acutely going up in ways never seen before. And just the inability to be economically safe and well created much more desperation that resulted in further violations and further violence becoming the norm of the day. So these horrors, require not just state action, but, gender-based violence is a social issue. It's socialized. It also requires wider societal reform, leadership, and change in order for us to combine series of state and non-state actions to come together to achieve what we are proposing governments need to do as individuals and as a collective.
And are other countries actually willing to come to the party when it comes to implementing different social reforms? Because I believe that it will start from teaching children from a young age, socializing them from the moment when they're children, how to relate to one another and not actually discriminate against one gender or the other.
Yeah, that's true. I mean, we will need to have that. We must deconstruct and debunk these social norms that we are raised with, which says that, if your husband is beating you, it's a sign of loving you. Many of the cases that came out of the report in Mozambique testified to, or rather provided testimonies of girls and young women speaking to this very issue. There was also the rise of child marriages, trapped in poverty, trapped in desperation, and being married away by their parents. So yes, there is a focus that has to be around just the family, society, and institutions of society, traditional leaders, civil society groups, the church, all need to come together to debunk and attack this very driver of gender-based inequalities and gender-based violence. And then, of course, we must rise to the point of policy and law, where not only the existence of laws and policies should be celebrated, we need to see how they are being implemented in stopping the violence, in strengthening the criminal justice system so that it is more gender sensitive, and in the actual measures put in place to deter any more occurrence of this sort of violations that we've been talking about. Beyond that, also need to see that in future pandemics, we need to see states taking on board experiences of women, experiences of young girls, experiences of civil society groups that work on women's rights into the design of policy, either to respond to pandemics or in addition to responding to eliminating the problems that I have raised. Mm-hmm. We saw the states failing twice. One, to deal with pre-existing problems, and then two, to deal with implementing lockdown measures that are gender sensitive and that limit the prospects of GBV. These are a combination of factors that will need to come together to unite nations and regions to fight against this scourge.
And just lastly, in terms of the accuracy of statistics, I know that amongst the different countries in Southern Africa that we mentioned earlier on, a lot of them had a rise in GBV figures, but Zambia was the only one that actually recorded a decline in the amount of GBV cases. Would you say that that's a true reflection of the GBV actually decreasing, or is it a matter of people not being able to report the incidences as much as they would have been able to before?
Yes, that's true. I mean, the official, mainly, police services provide this data of cases of reports that come into their police stations. But as you know, it takes quite some courage and an enabling environment for a woman to be able to access a police station. So a number of women just simply don't report cases of violations that they face within the home. So we must, look at the Zambian figure with that sort of background. Mm-hmm. The second is that while reports from the police reflected the decline, groups we worked with, including the Young Women's Association, YWCA, in Zambia actually recorded an increase. They look at quarterly data from 2019 to 2020 and saw that there was actually an increase of 18% from the information they dealt with in April 2019 to the information they dealt with 2020. And that represents for me the fact that if you scrouge around to other groups, churches, and other social groups that are documenting cases, you see a rapid increase. So it's an outlier, but I think the year is not ended yet. We will probably see much more numbers going up even in the official recording by Zambia. The rest of the countries from Madagascar, South Africa, Zambia, Zimbabwe, Mozambique, the numbers were going up, and the groups we worked with are very credible in terms of what they do. But this is just an underreported figure because most women who are victims of GBV don't go to the police. They are cynical about the effectiveness of the police.
Thank you so much. Let's leave it there for this afternoon. That was Deprose Muchena, who is the Amnesty International's director for East and Southern Africa, speaking to us about the report released earlier this week that found that COVID-19 pandemic has actually prompted an escalation in gender-based violence.